me and for helping me reach 4,000 subscribers, and now we are at 4,016 subscribers to be precise. YouTube, it is not easy. From 0 subscribers to 4,000, it is not easy, particularly being monetized. Get some cash. Now, back to the topic of today. I want to talk to people who have been looking for children. I've been talking about infertility for long, both primary and secondary infertility. And this is the time now that you should be joining me in this menace and help this particular man child to make her woman get pregnant very, very fast, and also to make this particular woman to get pregnant very, very fast without wasting time. Now, mostly in our clinics, we get disappointed by our men. We get disappointed by our men. Men, I am a man. We get disappointed because you people do not come to fertility clinic. These people do not come for counseling. What are you people afraid of? If you are a man watching this particular video and you're struggling to get a child, and now you do not want to come to the clinic, why? This is a video for you. Now, we want to talk about the drugs that are going to help you as a man, and also the drug that is helping you as a woman when you want to get pregnant. But before that, you need to be checked up. This is what men fears. A test called testosterone levels check. And more, the worst one that they fear most, sperm analysis. Why do you fear your sperm being checked? And you've been looking for a child. What do you fear? What are your fears? I want to kill that your fears, because if you have been living with this lady and she can't get pregnant, she can't conceive, then perhaps we can rather blame you because you've just refused to come for a test. Now, for us to discuss the matters of primary infertility or secondary infertility, the couples must be present. A lady cannot get pregnant without a man. And even if a man is not there, let's assume you do in vitro fertilization, a man must be searched and his sperms must be used. So a man is still in the picture. So you have your spouse, come to the clinic. First, let's start with the man. What will we do? We'll do testosterone level checkup, and also we'll do sperm analysis. We want to check whether your sperm has kinetic power of movement, swimming from the vaginal area, passing through the cervix, uterus, up to the fallopian tube for fertilization. We want to check that. Is its concentration, is it okay? What about the motility? Is it okay? Does it have any issues? Sperm distortion. It has even morphological distortion. We want to check about that. So if you are a man and you have this particular problem, just come. Let's do this particular checkup so that you are okay. Or even inherited diseases or genetical disorders. We are going to check about this so that we don't have any issues, whether you had a birth defect in that your particular penis, or you have a chronic STI which are preventing you from making this lady to get pregnant very fast, or you have genetic inherited disorders that are disturbing you. These ones are what we are going to check about. Did you go for any surgery of late, particularly herniorrhaphy, or you have an undescended testis which has grown with you and you cannot even feel those your balls? We will check them. Have you been exposed to high temperatures or even X-ray? Do you have any inflammatory disorders? These are what we are going to check if you are a man. So any man who fears coming to the facility for a checkup, and you leave this your particular spouse to suffer because you fear your spermatozoa to be tested. It is not fair to this particular. We meet these women in clinic and they are very, very disturbed. They are stressed because the man has refused. They are just saying, me, I'm okay. I had made a lady pregnant before. How sure are you that that pregnancy was yours? Did you do any DNA test that verifies that that particular child is yours? So, men, let us not blame our women. Let us not blame our women, because if we blame our women, we will not find this particular solution. I'm talking to men because they have refused. They have refused to join us in clinics. They have refused to join us in clinic. And if you see a man has come to a clinic, they know that he's paving a way. He's trying to talk to the doctor so that the doctor should talk nice in front of a woman. And this particular war, you cannot win it unless you people come together and talk together. So if you want to make your wife pregnant very fast, the first thing she will come to the clinic and we do all those checkups that I am talking about. Now, if you are a man here and you are listening to me and you have either primary infertility or secondary infertility, come for a checkup. Now, when I'm defining infertility, this is how we look at it. Having your woman having sex 3 to 4 times per week without any family planning for a period of 1 year without her getting pregnant, then we suspect there must be a problem. Sex 3 to 4 times for a period of 1 year without any family planning, without your wife conceiving, then we talk of infertility. Primary. Sex 3 to 4 times in a year, your wife has conceived 1 or 2 times, but now there's a period of time that is passing with her not conceiving, then we talk of secondary infertility. You want to know what is causing this particular menace in your family. So, ladies also, you must do a checkup. 1, history taking. In that, we are going to ask you, have you ever been pregnant before? Yes or no? Have you ever conceived before? Yes or no? That is the one thing. Have you ever had any miscarriage stroke abortions before? That way we normally ask, maybe before this particular marriage. And have you been exposed to any x-rays when you are not aware? Any chronic STIs, chronic sexually transmitted disease? I want to talk about this one into shortly. Many women, when they have gone for scan and they come back saying the doctors just diagnosed they say there's no problem. They say there's a PID, pelvic inflammatory disease. Know that now among the top 5 causes of infertility is infection, and mostly caused by pelvic inflammatory disease that remained untreated. And these ones normally scars your fallopian tubes, scars your uterus, make holes, potholes on those particular places, and this normally prevent implantation of the blastocyst to the endometrium. This normally prevents implantation. Fertilization sometimes might take place. Also, when the uterus, when the fallopian tube has scars, the fallopian tubes has what we call cilias. And if those cilias have interfered with, those cilias are the one that propels the ovums towards the fallopian tube for fertilization. And if there is potholes, scarring, then this one can prevent implantation from taking place. So when you have pelvic inflammatory disease, this one can block the tubes. The tubes need to be unblocked. Any chronic vaginal candidiasis which has not been treated, we are going to ask all about that. Any inherited genetical disorders, any problems affecting the entire uterus, maybe fibroid, uterine fibroids can grow big as they can grow big as big as the 20-liter jerry can, 10-liter jerry can. Endometrial carcinoma, that is cancer of the endometrium. The cervical cancers, we make sure that those are not present. Whether you have thick cervical mucus, can prevent the sperms for passing around towards the fallopian tubes, endometriosis, adenomyosis, and even the commonest polycystic ovarian syndrome or ovarian cyst that has not been taken care of. So we all do that in terms of, we can do CT scan, we can do transvaginal ultrasound, or maybe obstetric ultrasound. Also, we can do a stereosalpingiography, that is x-rays of both the tubes, just to be sure that your tubes are not blocked. So when these particular tests have been done, and you know, this management of infertility will be case by case. Your case can be different from the other person's case, can be different from the other person's case. So even before we introduce the drugs that I've been talking about in this particular channel, all those particular investigations must be done first, just to ensure that there is no problem about this particular problems of making you not to conceive. Now, when we've done this and everything is okay, a man is okay and the woman is okay. Also note that causes of infertility, there's a cause which is unknown. Mwanaume ako sawa, the man is fine, the female is fine, but there is no problem. That is also falling among the unknown cause of infertility. Therefore, we tell you, omba Mungu, pray to your God. That is where we say now God's time is the best. But we introduce fertility drugs. Even before we go to other methods like artificial insemination, in vitro fertilization, intrafallopian tube transfers, intracytoplasmic sperm injection. Those are the methods that can be used when maybe drugs have failed. I'm coming up again. Artificial insemination of the semen, like the way we do in our cows. Those are done in fertility clinics. In vitro fertilization, intrafallopian tube transfers, and even intracytoplasmic sperm injection. This one, they can even select and even do what we call gender selection. Gender selection, you want to conceive but you want twins, boy, they can do that. Or girl, they can do that. If you want triplets, they can do that. Infertility clinics, advanced fertility. I normally refer my clients to Eldoret, some also to Nairobi. They normally do that and they are okay. Now, if at all there are no problems surrounding your uterus or surrounding your penis, simple ovarian cysts, we can do watch and wait plus drugs. Watch weight drugs. If it is not exceeding ovarian cyst measuring below 3, that is 3, maybe 2 by 5, 2 by not by 5, 2 by 2, 2 by 2 by 2, 2 by 2 by 3, 2 by 2 by 4. But now, size of ovarian cyst that is greater than 5. Please like the video, subscribe to this channel. Like the video, subscribe to this channel. That one may need surgery. An ovarian cyst that is greater than 5 centimeters and it's presented by severe lower abdominal pain. You cannot do your normal course. You are constantly in pain. Even discharges are coming out. Then surgery may be preferred. And it doesn't mean that if you have a surgery of an ovary, then that now you can't conceive. There is types of how they do it, unless they do what we call they remove all the uterus, that is TH, that now you are not able to conceive, or or maybe they remove one of the ovaries, you can still conceive because the other is present. And all the drugs that are there can also help. I've been talking of fertillion F and fertillion M, that now I want to conclude this live by talking about them. So stay tuned, do not move. The amazing people watching me, I want to talk about now the important part about this drug. Now, men, you can have infertility because maybe of erectile dysfunction or premature ejaculation. These particular drugs normally help. You've been listening to me, you've been watching my videos. I've been talking about Manix. And mostly I tell people to avoid the blue pill. The blue pill is not so much good. I've been talking about Manix, and now I've been talking about fertillion F, that and M. This is the drug that I want to talk about now. I don't know whether it's hearing well. Fertillion M for men, and fertillion F for female. And these drugs are very, very important in management of female infertility. Now we've done investigations. We've found that this is now your problem. We've managed that problem, but now we add this particular drug so that it can help you to conceive. Now, for men, because I started with men or women first. Now let me start with women now. For women, you use fertillion F. I've made a video about fertillion M and fertillion F. If you are a member of this particular channel, just scroll through my videos. You see one of the video of fertillion F and one of the video of fertillion M. And this one may help you in restoration of ovulation, improves chances of conceiving in the management of female infertility. Now, this drug contains some components, 6 to 7 components, which are very, very vital. We have myo-inositol, D-chiro-inositol. It's a hard term to mention, but now it's very, very important because it is an insulin sensitizing agent which supports proper hormonal balance, ovulation, ovarian functions, equality, and regulates menstrual cycle. So the myo-inositol and the chiro-inositol does that. Even the L-arginine that is present in the fertillion F normally improves circulation to the reproductive organ and enhances oocyte development and implantation of the embryo. So this drug is very, very important. Weight is also associated with infertility. Weight is also associated with fertility. If you are overweight, if you are weighing so much and you are short, or you've not checked your BMI, basal mass index, kindly check your weight and your height, and the doctor will help you to calculate your BMI. And when your BMI is high, the nutritionist can do you counseling. And when you are craving or you like carbohydrates or a lot of carbs, you will eat a lot of carbs. You will increase vegetables and fruits because this particular drug contains chromium. Chromium is important in relation of reducing body weight. So if high body mass index is associated with infertility. So if you are a lady, if you are a man, make sure that you reduce your body weight. Folic acid is very, very important because it will prevent those defects called neural birth defects, the spina bifida. Vitamin D3 regulates the menstrual cycle, and this one may prevent infertility because of folic acid that I've said, and antioxidants that counteract the oxidative stress. So in general, fertillion F, that is F for female, promotes ovulation, improves concentration rates, reduces miscarriage rates, maintain regular menstrual cycle, and reduces fasting insulin levels, which is associated with the homocysteine levels in polycystic ovarian syndrome patients. So how do you take this particular drug? Soft gel of 2 capsules, you take them twice in a day before meals. You take them twice in a day before meals. So fertillion F, I've made a video about that. Kindly go and watch in this my particular channel for more details. Fertillion M, in management of infertility, that is now for men. It's very, very important. because it contains around 5 important components that optimizes sperm health and assures infertility. Lycopene. Lycopene increases sperm concentration and motility, and together with L-carnite, improve sperm maturation and motility in the epididymis. And that's why we talked about sperm analysis. The coenzyme Q10 improves sperm kinetic features, which is very, very important. Ginseng and folic acid improves sperm count. That is very, very vital. And antioxidants, that is vitamin C, E, and selenium and zinc, promote sperm from oxidative damage. So fertilon M is very, very important to promote and improve male fertility, in that it improves sperm count, motility, morphology, and semen deficiency. 2, it improves antioxidants capacity in semen, thereby improves semen quality, and beneficial for treating those who have been having oligospermia, azoospermia. This is the best drug for you. Then maintains hormonal balance and improve testosterone production. Same way, 1 soft gel capsules to be taken twice daily with food. Now, if you have any other question related to female or male infertility, kindly DM me, send me a direct message, and everything will be okay. Signing out, this is your Dr. PAMLI, and continue visiting this our channel. Kindly share for all the videos that we be posting. Muchas gracias.